Hi everyone, today I'm talking about the neurobiology of Adderall and how it helps treat ADHD from a biological perspective. Adderall is made of mixed amphetamine salts, and this presentation looks at how those salts affect brain chemistry, executive functioning, and attention. I'm also going to connect its clinical benefits to its risks, including tolerance and abuse potential. Faraone, 2018, Heal et al., 2013. Adderall is a fully synthetic stimulant. It contains a mixture of dextroamphetamine and levoamphetamine salts, and that combination helps produce effects on both dopamine and norepinephrine systems. It is FDA approved for ADHD and narcolepsy. And in ADHD, it is used to reduce symptoms like inattention, hyperactivity, and impulsivity. Outside of medicine, it is sometimes referred to as a smart drug, but that label ignores the fact that it is a powerful psychoactive medication can be understood with real risks if misused and effective terms. American Psychiatric Association, it can reduce distractibility and hyperactivity Castells while improving 2018. Heal et al. Cognitively, 2013. It can improve working memory, sustained attention, and response inhibition, especially at therapeutic doses. Effectively, some individuals report improved motivation and alertness, but others may experience side effects like irritability, anxiety, or a crash as the medication wears off. Adderall is the most commonly drug that improves executive which allows for a more controlled rise in emotional side effects than depending on dose, with timing, and individual response. After ingestion, it is absorbed mainly through the small intestine, and because amphetamine is lipophilic, it crosses the blood-brain barrier relatively easily. 2017. Peak plasma levels are generally reached within a few hours for immediate release formulations, while longer-acting formulations are designed to maintain symptom control across the day. That slower and more controlled delivery is important because mainly in the liver, therapeutic benefit without the rapid contributing to part of that are more strongly linked, and the drug is then excreted through the kidneys. One especially important detail is that urinary pH changes how quickly the drug leaves the body. More acidic urine speeds excretion, while more alkaline urine slows it down. Because of that, the duration and intensity of Adderall's effects are shaped not just by dose, but also by how the body processes and clears the drug. Childress et al. 2019. Adderall increases the synaptic availability of dopamine and norepinephrine. Amphetamine enters presynaptic neurons through dopamine and norepinephrine transporters, disrupts vesicular storage through VMAT2, and promotes reverse transport of neurotransmitters into the synapse. The result is increased catecholamine signaling in brain regions involved in attention, motivation, and executive control. This is why Adderall is considered an indirect agonist. This mechanism rather than explain why Adderall improves ADHD symptoms. It increases neurotransmitter activity is associated with altered catecholamine signaling instead of directly binding prefrontal cortex or norepinephrine, which is critical for working in the same way a classic agonist would. And attention regulation. 2018. When dopamine and norepinephrine levels increase in these circuits at therapeutic levels, signaling becomes more efficient. Norepinephrine helps strengthen task-relevant signals, while dopamine helps reduce background noise, which improves the signal-to-noise ratio in the brain. With repeated stimulant exposure, the brain can adapt over time, network interference, which is why tolerance can develop in some individuals, which may help decrease mind-wandering neuroadaptation and catecholamine systems. American Psychiatric Association, and timing of tolerance vary across patients. Castells et al. 2018. Faraone, 2018. Schedule II controlled substance because it has a significant potential for misuse and dependence. In therapeutic use, especially when taken orally as prescribed, it increases catecholamine signaling in a slower and more controlled way that supports executive functioning. But when it is misused, especially at higher doses or with faster routes of administration, dopamine levels can rise much more rapidly in reward-related brain regions, such as the nucleus accumbens. That is what increases euphoria and reinforcement. So the abuse potential comes from both the drug's pharmacology and the way it is taken. Heal et al. 2013. Martinez-Raga et al. 2017. Childress et al. 2019. Overall, Adderall helps treat ADHD by increasing dopamine and norepinephrine signaling in brain systems involved in attention, motivation, inhibition, and executive function, Its therapeutic effects can be understood through both pharmacokinetics, meaning how the drug moves through the body, and pharmacodynamics, meaning how it changes neurotransmission at the synapse. At the same time, the same neurobiological actions that make it effective also explain its risks, including tolerance,